Right now at 5, several Milwaukee aldermen are calling on Ascension Healthcare to hold off on their plans to downsize St. Joseph's Hospital in Milwaukee Sherman Park. Tom Durian was at today's press conference. He's in the newsroom with more on what they had to say in reaction from Ascension. Tom.
Well, hi, Carol. The company has said that this will happen in 2 phases, the closing out of some services and then the addition of others. But the aldermen are worried that this is just the beginning.
Disease knows no geopolitical boundaries. Disease spreads throughout our community.
Several Milwaukee aldermen and the interim health commissioner warn the future of health care is grim if services continue to dwindle in the inner city.
You see them over time that that commitment to the ability of people to come and sick, no matter how sick they are, to get care, is actually changing a lot.
Alderman Bob Donovan is calling on Ascension Healthcare CEO to put the brakes on changes at St. Joseph's until a meeting with the community can shed light on what's needed.
I am asking him personally to see that Ascension postpones this reduction of the St. Joseph campus for at least 1 year.
Ascension Healthcare hasn't responded to our direct request for comment, but did talk with our colleagues at WTMJ Radio. Wisconsin Executive Bernie Sherry says St. Joe's will continue to operate the busiest emergency room in the state, but open more primary care physician offices while it shifts some services to other locations.
One thing we're trying to do is to look at what the primary needs are and to provide that, and access to care is critical.
So the hospital will continue its ER and women's health services while transferring most cardiac services to Columbia St. Mary's, which they also own. Ahead at 6 o'clock tonight, we're going to hear how aldermen believe that these changes will have a negative effect on other hospitals in our area. Also, what appears to be some good news for St. Francis on the city's south side. That's at 6. Carol?
That sounds good. Thank you very much, Tom.